All right. So it is right at 5 o'clock. Good evening, everyone, and welcome to the next session in this how-to series for practical climate action for Caribbean health professionals. Our session today is how to gather and share data for effective climate action in health. My name is Saria Hassan. I'm an assistant professor at Emory at the School of Medicine and the Rollins School of Public Health. I am a clinician and implementation scientist working in the intersection of climate change and non-communicable diseases, and truly have the honor of moderating today's very exciting session. And so just to tell you what this how-to series is, the goal of this monthly webinar series is to focus on equipping health professionals with hands-on techniques, leadership strategies, and teaching tools for promoting climate action in different settings. Our learning objectives for today are to explain how access to robust and region-specific data enhances the ability of health professionals to respond to climate-related health challenges that include heat-related illness, extreme weather events, and vector-borne diseases. We also hope to explore common challenges in sharing and integrating climate and health data at national and regional levels, and learn about the tools and the best practices to improve collaboration across health systems and sectors. A reminder to those of you seeking continuing medical education credit, it is available for this session for those in the CARICOM locations. There will be a survey link that will be posted in the chat at the end of the session. Absolutely critical for you to click on that survey link at the end for you to be able to access, again, for CME credit. As we start looking at our amazing panel of speakers, I want to remind you to please post all questions that you have during these amazing presentations in the Q&A section, not the chat. So please put your questions in the question and answering section of Zoom, and we will be sure to compile all of the questions and get to as many as we can at the end of the presentations. So you see here our amazing group of panelists, Dr. Paula Henry, Dr. Roché Mahon, Dr. Laura Boodram, and Dr. Dahlia Plunkett. I think we are truly in for a treat today. And so without further ado, let me first introduce you all to Dr. Paula Henry. So Dr. Paula Henry is a primary care physician and a public health practitioner. She graduated from the University of the West Indies in Jamaica in 1980. She holds a diploma in family medicine, an MBA, and an MPH. In 2019, she completed with distinction the Climate Change and Health Certification course offered by Yale, and is a member of the Caribbean and American Colleges of Family Physicians and the World College of Family Doctors, and the Caribbean Planetary Health Regional Hub. She is a director of EarthMedic, EarthNurse. She holds a diploma in political science from the University of London School of Economics, considers herself a social scientist per excellence. Dr. Henry is passionate about policy change as a pathway to sustainable solutions to the climate crisis. So without further ado, I will hand the visual microphone to you, Dr. Henry.
Okay, thank you very much, Dr. Hassan, Saria, as we call her. So thanks for that very generous introduction. So as Saria told you, I am a primary care doctor, and let me just share my screen as I introduce myself. So I'm a primary care doctor for the past 40 years, and I have been as a public health practitioner for the last few years. But today I want to talk to you mainly from the point of view of a social scientist. So I am a director of EarthMedic, EarthNurse, but today this is what I will tell you about. This is my topic, a how-to series, data sharing, and I'm going to share a story on heat. We have a poll question, Daniele. Before leaving home, do you routinely find out the heat index for that day? It's a yes or no answer. Do you routinely find out the heat index for that day? Okay, almost steady, 77%. Okay. Okay, so it's 1 to 3. We can close the poll now. I think we have the answer. So 1 in every 4 would find out what the heat index is before they leave home. So I hope this would change. I hope this statistic would change by the end of my lecture. Am I sharing the results? Okay, stop sharing. Okay, I can't control that. Are you controlling that, Haley? I'm sorry, Daniele.
Yeah.
Okay, so I can continue with my presentation. Okay, so I'm going to do things a little differently today. These are my references. And I want you to note that, very importantly, I did focus interviews with the leadership in meteorology, air pollution, and health. And my objectives for the evening would be, by the end of this session, participants will be aware of data sources of climate variables and opportunities for forecasting in Trinidad and Tobago. We will also find out how this information reaches health practitioners, how easy it is to access this information, and what are the mechanisms for feedback. So I'm not going to tell you very much about this slide because you're going to find out a lot from other presenters, but I want you to know that we get the very best information from all of the above. CIMH, we're going to hear from them, and NOAA. And this data reaches the Met Office of Trinidad and Tobago. And what do they do with that information that they get? Well, we see here that because I'm into the Ministry of Health, I'm into health. So we see here that that message gets out to a lot of different important people, the Office of the Prime Minister, the ODPM, local news outlets, but most importantly, it gets out into the Ministry of Health. And that's my focus here today. And what is the Ministry of Health? What do they do with this information in terms of us as practitioners? Well, the hierarchy of the organization, they get together and they decide what is the best information to release to the public. And they release this through a media release. And we as health practitioners, as you see here, we get our information via the media release, like everyone else. We get it at the same time. And the health practitioners say, oh, quite often we get the media release too late. And sometimes the message is not as accurate that we would like. So why did I put this slide here? I put this slide here because we are in the post-colonial era. And we need to understand that we have inherited a bureaucratic governance structure from our colonial masters. And it's time for a paradigm shift. Why? Because we need to build climate resilient health systems. That is what it's all about. And if we are to build that climate resilient health systems, we need to begin to do things differently. And this is what I'm going to address today. So, what information do we as doctors want to share with the powers that be? We want to tell people, I just want to make sure that I have the correct slide here, as I didn't jump a slide. Okay. Okay, I am jumping and I want to make sure that, oh, okay. So sorry, I'm a bit immature this. So I'm going to go back again. You all are seeing me? Are you seeing my slideshow?
Yeah, we were seeing it fine.
But are you seeing it now?
Cool. You,
Okay, so I think
No, you're
I
not sharing.
jumped ahead of myself. Okay, so I'm so sorry about that station break. Okay.
Do you want me to share for you, Paula?
No, I am good. I am good. Let me just get this together. Okay, I'm going to start from the beginning and I'm going to go. I just want to make sure I didn't miss anything. Okay, right. So here I am, and we're talking about the fact that we now live in the post-colonial era. And this is very important because we have inherited a bureaucratic governance structure from our colonial masters, and it's time for a change. And what information do we as practitioners want to talk about? We want to tell you about the heat index, and that when it reaches a critical level, one, the attention of our students fall through the cracks. So it's all about the heat index. And the productivity falls significantly in our population, not just in outdoor workers, but in the agricultural, construction, and the sanitation workers. But we also get more heart attacks. We also get worsening of our NCDs, people going to acute renal failure, complication of diabetes, cardiovascular diseases.
Paula, your
Sorry,
slide.
we're not seeing the slides.
Unfortunately not.
You're not
We're
seeing
not
my
seeing the
slide?
slides. No.
Okay, so then let me ask, okay, let me come out and let me ask
Daniele.
Danielle, share for me there.
Is that the slide, Paula?
You want to go back?
No, we need to go back another slide. Go back again. Right, next slide. Next slide, next. You went too far.
There is no
Go back
slide
again.
before that.
Okay,
Have that.
okay. Right,
This-
so we're talking about next slide. Okay, mechanism for feedback. I will tell you about that. Next slide. Okay, so what is the heat index? The heat index is not, we don't measure that by measuring the temperature, okay? And if you were to look at the Weather Channel, you will see that today the temperature was 33 degrees centigrade. But that's not what it's all about. It's all about the heat index. Next slide. Next slide. Okay, so this is the slide I want to focus on. What is the heat index? So the temperature is 35 degrees Celsius, but the heat index is based on the humidity. So you see here that we are in the red zone. And that is serious because we are often in the red zone. Go back one slide. I'm so sorry, my slides are a little bit disorganized. Okay? And this is what exactly happened. Next slide, go back. I'm so sorry. Okay, so this is the story of what exactly happened. So on September the 27th, 2024, at 5:31 p.m., I was living, at that time I was staying in Arizona, and I wrote to my colleagues and said, this is a woman's MD chat with 129 of the top doctors in Trinidad and Tobago. I said, hi, does anyone know the heat index for Trinidad and Tobago? Not being an alarmist, just wondering. And the next day, one of the top doctors answered, hey, Dr. Henry, your question yesterday prompted me to do some checking. The heat index was moderately high, almost high. Incidentally, that day, we had a temperature of 33 degrees centigrade with a humidity of 80 degrees. And as you see, we were in the red zone. And then there was a diarrhea for 3 days. Everybody wanted to talk and tell about the heat index. And one of our top doctors said, I totally agree. I used that same heat index chart as proof that we needed cooling fans at the Eric Williams Medical Sciences Complex. That is one of our top hospitals in Trinidad and Tobago, because the patients were often sweating profusely and very uncomfortably, and we are still waiting for actions. No fans yet. Somebody said, yes, I had several cases of elderly patients in the hospital who could not attend to themselves because they developed electrolyte imbalance while on the ward from the sweating. And then somebody said, oh, I lost my koi's in my outdoor pond due to heat stress. And this was based on necropsy findings. Next slide. So I asked Dr. Hospitalis to send me some information about the Trinidad and Tobago Weather Center, and he sent me this. And this is a picture of the heat indices in Trinidad and Tobago on the 24th of August in 2023. And you see there 52 extreme danger. Does anyone ever remember that day? Oh, we would remember earthquakes where nobody died, but did we remember that day when several people probably would have died from heat stroke or heart attacks? Next slide. Next slide, please. So, the slide before. Right. So I went on the Trinidad and Tobago Weather Center channel, right? And I found this. And this was for today. And you see here, we are red. And so I asked you, how do we feed back this information to the powers that may be? We don't have any way to feed back. And I wanted to tell you the story, that was an earlier slide, of COVID-19. Okay, my last slide, and I will tell you the story of COVID-19 while you're looking at my last slide. So this is my last slide. And now let me tell you of the COVID-19, how we as practitioners can give feedback to the powers that be, the Ministry of Health. So we as family doctors, we were very, very, I would say, upset, or we were very concerned that we did not have a way to feedback information about the side effects that we were seeing in COVID-19. So we actually found out what we needed to do. And through a long process, we found out that there was indeed a form that we could fill out. And I want to tell you that we got no feedback on that. And when we made some investigations, well, sadly, we found out that they were filed, and we are waiting further investigations on that filing. Thank you for listening.
Thank you so much, Dr. Henry. I think realizing the importance of the heat index, and encourage all the listeners, please, if you have any questions, please put them again in the Q&A section. But we will charge ahead, and I would like to introduce Dr. Roché Mahon. She's the social science lead for the Interdisciplinary Climate Services Program of the World Meteorological Organization's Regional Climate Center for the Caribbean, that's hosted at the Caribbean Institute for Meteorology and Hydrology, CIMH. In this role, she works with a regional consortium of climate and sectoral experts to co-design, co-develop, and co-deliver tailored climate information products and services for 6 climate-sensitive sectors in 16 Caribbean countries. Since 2017, Dr. Mahon has been the coordinating co-author of the quarterly Caribbean Health Climate Bulletin, co-produced by CIMH, the Caribbean Public Health Agency, and the Pan American Health Organization. Thank you so much, Dr. Mahon.
Thank you, Saria. Can I have confirmation that you're hearing me and as well as seeing my screen?
Yes, absolutely perfect. Thank you.
Perfect. So thank you again. Good evening and welcome everyone from wherever you are across the Caribbean. I think this is an excellent turnout from the health community. I'm very pleased to see all of you here. Thank you for taking the time to be with us. So for those of you who don't know me, and I apologize, I'm traveling on a device where my camera is not functioning. So forgive me, but I'm Dr. Roché Mahon, and yes, I'm the social scientist at CIMH, the Caribbean Institute for Meteorology and Hydrology. So colleagues, as the social scientist at CIMH, I do work with 6 climate sensitive sectors that we serve actually at the Caribbean Regional Climate Center, which the Institute, which CIMH does host. And of course, the health sector is one of the 6 climate sensitive sectors that we serve. So before I begin, I do want to take a moment to thank the Global Consortium on Climate and Health Education and EarthMedic and EarthNurse Foundation for this opportunity for the climate community to interact with you and to make this presentation. It is actually a joint presentation across Dr. Laurelie Boodram, who's also on today's panel. We also have Dr. Cedric Van Merbeek and myself. And we, across these 3 of us, we represent, of course, CIMH and CARPHA. And we are all co-authors on the Caribbean Health Climatic Bulletin. I also want to acknowledge the larger HCB, so we call the Caribbean Health Climatic Bulletin, the HCB for short, Caribbean HCB for short. I do want to acknowledge the larger co-author team that does make this bulletin possible. So as you can see here, there are actually about 7 of us that work on this bulletin every quarter, and we each bring something to the table that makes this process work and this joint product come together. So today what I want to do is to share with you the experience of these lead regional agencies that work across climate as well as health. So CARPHA, PAHO, the Pan American Health Organization, of course, as well as CIMH in co-producing the Caribbean Health Climatic Bulletin. And actually, this is the model that we have found to be most successful in terms of not just bringing the communities together, but bringing the data sets together, blending those data sets so that we are able to co-design, co-develop, and co-deliver a tailored product for the Caribbean health sector. So of course, our 3 agencies, work together on many different things. We have, for instance, a research and development program. But, today, I think we really want to focus on what we've been able to achieve with the Caribbean Health Climatic Bulletin, because, the momentum that we've had with this particular product has been really good. And I think we've been, successful in co-delivering a climate smart tool for the Caribbean health sector. This is a model that we would encourage, downstreaming at the national level across the ministries of health, as well as your respective meteorological organizations. So I want to begin by saying something that, many of you may already know, and that is that many aspects of our climate are actually monitored and predicted by the Caribbean Institute for Meteorology, as well as our community, our network of Met services. In fact, we have quite a large resource pool of not just climate, but also dust and air quality early warning information products. And so we have, for instance, experimental climate products like the new Caribbean Fire Weather Monitor. Of course, that would be a very useful tool for monitoring wildfires and the respiratory illnesses that are associated with an increase in wildfires, particularly in the Caribbean dry season. We have sub-seasonal forecasts as well on temperature and rainfall. In terms of climate services for extreme weather events, of course, a highlight product that we produce and deliver on behalf of the region at CIMH, CIMH's Atlantic Hurricane Season Forecast, excuse me, as well as wet spells forecast. We also have, as I said before, dust and air quality forecast. And all of these products taken together can provide useful information that can be applied to a number of health outcomes, health outcome areas, And actually, in the Caribbean Health Climatic Bulletin, we do provide information across 5 categories of disease. So respiratory illness, vector-borne illness, non-communicable diseases, as well as well-being and mental health. Now, when it comes to responding to the needs of the health sector, I think what was interesting for us at CIMH and our larger community of Caribbean Med Services was the result of, excuse me, a 2017 PAHO country survey on health and climate change. And you see the results on this slide here. And as you can see, the results do make clear that Caribbean health professionals did rate many topics where CIMH was actively doing monitoring and forecasting work. And as we go forward, interdisciplinary work as either important or extremely important. And you see the climate sensitive themes here, themes that I mentioned recently, like vector-borne diseases, weather and emergencies, food safety and security, waterborne diseases, heat-related illnesses, etc. So when we looked at the results coming out of this survey, we saw a real opportunity to use our monitoring and forecast information as a basis for providing a more tailored service to the Caribbean health sector. And so this is where our investment in partnerships with regional health leaders like CARPHA and PAHO came into being. When we decided to approach them to develop a health-specific climate information product. I think we've had a lot of success with this model, as I said before, and a common success story, of course, is the quarterly Caribbean Health Climatic Bulletin that has been jointly co-authored and co-developed across our 3 institutions since May 2017. And in fact, hopefully, many of you on this call are aware of the Caribbean HCB, not just aware of the HCB, but hopefully you do access it frequently for your decision making. We have been co-developing this Climate Smart tool for health practitioners for over 7 years now, about 32 issues in. And I think, for us, we can say that we consider it to be, a very important integrated health climate early warning product that messages out, the implications of seasonal climate. So, forecasted climate conditions in the next month to 3 months to 6 months, and what are the health implications across the region, the potential health implications across the Caribbean. So how does the Caribbean HCB really help health practitioners like you to make strategic and operational decisions related to health interventions? Well, it does provide, for instance, health administrators and doctors with the seasonal climate early warning information that you need to identify and prepare for upcoming, whether it's favorable climate or unfavorable climate conditions, as I said, in the next month, 3 months, 6 month period. And so perhaps the most useful information that we provide in the Caribbean HCB are the implications of forecasted seasonal climate in these 5 category areas that I mentioned earlier. And so I think, colleagues, if some of you have already accessed the HCB, you understand, what I'm saying here in terms of the value that having these tailored messages have to your decision making. All of these categories are given a space in the bulletin. And so in that way, I think we are feeding into your decision-making process. So it did make sense for us at the Caribbean Regional Climate Center to work with our health partners at CARPHA and PAHO to message out how forecasted climate conditions are likely to influence climate-sensitive diseases. This is what we've sought to do. Here's what some of your health colleagues have said about our efforts. So we did have a testing session in September, across September to November 2022. And I'm here showing you feedback from the range of health stakeholders that participated in those sessions. Maybe a few of you were part of those sessions. We had doctors, nurses, surveillance officers, epidemiologists, even psychiatrists give us feedback. And as you can see, these colleagues were saying that, you know, in general, it was an excellent document. It is an excellent document, with others saying it's a very good resource with good information that health practitioners can use. One colleague even described themselves as new to working in epidemiology and surveillance within the Ministry of Health. And, you know, this has really helped that professional to guide their preventative actions as it relates to disease control, I'm sure, in collaboration with his or her team. So this is positive feedback. It's always encouraging for us to hear this. You know, as the Caribbean HCB team, it tells us that our co-development work is perhaps making a difference in helping health practitioners to make better climate-related decisions. You know, for me, I think the Caribbean HCB is a tangible example of a co-developed health climate product that, you know, can come into fruition, and it certainly has at the regional level because of, you know, partnership. And so, as you can see, you know, we have Dr. James Hospitalis, former head of CARPHA, on this call, signing a high-level multi-year letter of agreement with CIMH Principal Dr. David Farrell, and CARPHA has faithfully signed that LAA that enables us to work together on this joint program. We see more recently Dr. Joyce and John signing, and it's been a really good working relationship. So colleagues, I think it's important. I just want to touch on this point that the regional level effort has been going well. But I think it's important for us to understand that, you know, the partnership that we're seeing at the regional level on the Caribbean HCB is not really happening yet to an extensive degree at the national level. And so, in fact, from our research, from our interactions and experiences working at the national level, we know that we have a very real challenge to overcome. I have some baseline data that we did a study on, or emerges from a study that we did in 2017. And that showed that very few of our Met services across the region were actually engaged in producing specialized products for major sectors generally. And in particular, as you can see, the health sector you know, was not very well served, especially compared to, let's say, the agriculture sector. And I think that is one of the major challenges, maybe on both sides of the spectrum, not just for the Met services, but the Met service personnel are not accustomed to really interacting with and serving health professionals. And so at the time in 2017, only one country was producing a specialized climate information service for the health sector. But as we know, downscaling, you know, this information from, let's say, what's being provided in the Caribbean HCB to the national level is what, you know, is where the most value lies, because then you would have better targeted information that can help you to better inform your strategic and operational decisions, information that is very country specific. And so this is the next frontier for you know, climate health information going forward. I will say that we have made some progress across time. For instance, I can point to the PPCR initiative, which we implemented some years ago, way back in 2018 or so. Through that initiative, we had capacity building, we had that interaction happening between the health and climate communities in a handful of countries, particularly St. Vincent and the Grenadines, Dominica, Grenada. And what we were able to do is to get as far as building the capacity of the Met services to message out health climate messages in their monthly climatic bulletins. And you see the 3 examples on the right-hand side of your screen there. We do have a newer effort that's ongoing through the EU-funded Climate Change and Health Project that some of you may be familiar with, particularly colleagues on the call who may be from Barbados, Grenada, St. Lucia. We are working with these countries currently to continue to advance that type of work where we downscale the information in the Caribbean HCB to the national context. And I think going forward, in the years to come, that, as I said before, this really is where the next frontier is in terms of, climate data and information for decision making that is more targeted because it is country specific for health colleagues. And, I sincerely believe that, that is the heart of the agenda going forward. It's answering this question: how can we catalyze the development, the co-development of health climate communication products in Caribbean countries by having, for instance, the ministries of health and the Met service personnel at the national level working together to co-produce that type of information. And from experience, I know the answer to that question would vary in each country that we work with, given the many and varied challenges across different countries. But over time, I think that we continue to be optimistic that we will overcome these challenges and make good, if not great, progress here in the Caribbean. So, colleagues, I want to thank you for your time and attention today. To close, I'll say again that if anyone is interested in accessing the range of climate information products produced by the Caribbean RCC Regional Climate Center hosted at CIMH, you are free to visit our website at rcc.cimh.edu.bb. Unfortunately, I do think the website seems to be down at the moment, but that is unusual. So you can perhaps visit again tomorrow morning. That should be fixed. And there you'll find a full suite of climate early warning information, as well as the most recent copy of the Caribbean Health Climatic Bulletin. So thank you for your time and attention, colleagues, and I'll stop here. Over.
Thank you so much, Dr. Mahon, and exciting presentation. Great to learn so much about the bulletin. And yes, we were trying to access the website and couldn't, so now we have an explanation, but we'll all save those websites, so as soon as it's up, we can all explore as well. But thank you for an engaging presentation.
Thank you, Saria. Thank you to everyone.
We will now transition to Dr. Laura Lee Boodram, who is the current head of the Caribbean Field Epidemiology and Laboratory Training Program at the Caribbean Public Health Agency, CARPHA. The agency provides technical cooperation in public health capacity building and laboratory reference services to 26 member states in the Caribbean. Dr. Boodram holds a PhD in biochemistry from the University of the West Indies and an MSc in epidemiology from the London School of Hygiene and Tropical Medicine of the University of London. Dr. Boodram's primary work centers around multidisciplinary training initiatives for public health workforce development, infectious disease epidemiology, the effects of climate change on health, and disaster risk management. Dr. Boodram, the floor is yours.
Hey, thank you so much, Saria. Just 1 second while I share my screen. Okay, so good afternoon, colleagues. Today I'm just going to give you all a brief chat on some work that CARPHA has been doing in terms of the development of climate-informed disease early warning systems. So you would have heard Dr. Mahon speaking to collaboration and all the very good work that we're doing in the region. So I'm very happy to say that CARPHA, in partnership with CIMH, the Barcelona Supercomputing Center, as well as the Inter-American Institute for Global Change Research, We've all been working on these early warning systems for quite a number of years, since 2017, 2018. And what we've been trying very hard to do in the last few years is to take these systems and these initiatives out of the research phase and move forward to actual implementation and operationalization within the countries that we serve. So first of all, there's a caveat to this presentation. A lot of this work is actually the brainchild of Dr. Rachel Lowe, who's based at the Barcelona Supercomputing Center, and she is a fantastic mathematician and biostatistician. So if you have any hard questions, yes, I'll take them, but I may give you an answer a little later on. Okay, so just delving a little bit into climate-informed early warning systems. Within the Caribbean, we have different types of early warning systems. And what we ideally would like to do is to reach a point where perhaps we can integrate our climate information with multiple disease risk factors to aid our countries in implementing timely prevention and control measures. So we have our seasonal climate forecasts. They might be 3 months or 6 months in advance. And the data that they provide there, coupled to our health and environmental data, can be combined to generate predictive models that hopefully can anticipate epidemics several months in advance. Right? So the type of work that we do, some of the models, they are based on the Bayesian framework, and we try to make these probabilistic statements about future disease risk. And recently, I'm just going to give an example, but we've been able to successfully pilot it with a mass gathering event in context. So during, well, not this current World Cup, but Football World Cup in Brazil some years ago, Dr. Lowe and her team would have started building these dengue early warning systems, again, integrating that climate element. So the work that our team does would have first started against there, within that time frame. And we've continued to grow and enhance the data sets that we've been working with and trying to improve these models over time, taking into account different factors. We do have to say there's a little bit of a caveat. Sometimes the El Nino effect can be a little unpredictable and affect the models that we're working with. But apart from that, they are reasonably stable. One of the good things, of course, for these early warning systems is that they provide evidence for climate and health bulletins. So we do introduce a bit of what we produce out of this into, for example, the bulletin that Roché would have been speaking about that we jointly produce. In terms of some of the initial work that was done in the early days, and I'm just giving the example of Brazil, that particular model, and it was a dengue early warning system model, was developed in conjunction with the Ministries of Health in Brazil, as well as their meteorological services. And they used dengue data, climate data, cartographic, demographic data, socioeconomic data as well to formulate that particular model. And they were actually able to come up with probabilistic dengue predictions for greater than 550 of the microregions within Brazil itself. And what they would have done was establish certain trigger alert levels that would allow for determination of low, medium, and high risk for these different areas. Okay, and all of this would have been piloted during the World Cup at the time. So just to take a quick glance of what some of these models look like, they're actually very sophisticated mathematical equations, and they, of course, take different things into account. So, of course, we have our disease health cases, but related in space and time. We take into account observer versus what is actually, or what would have been expected for that particular period of time. We integrate climate and non-climate effects. There's some random and unstructured effects that we have to cater for. So yes, all this lovely, fancy looking stuff there, which I somewhat understand. right? I have to say, Dr. Lu and her team, they're really the brain child behind this. I do understand what goes in and I understand what comes out. And as a health professional, that is important for me. Okay, so in terms of that early model that they were developing, as I said, they were able to generate thresholds and alerts for different regions within Brazil. And the model itself actually worked pretty well in terms of predicting low levels of risk, medium, and to a certain extent, high levels of risk. But we realized there was a little bit of a disparity, so some additional work had to be done, and the model had to be adjusted a little bit in order to improve the level of prediction. Now, I did mention that the El Niño events can offset or upset the model a little bit, so that's some work that we do really need to continue and try to cater for in the future. So this little graph that we have here is related to some of the previous work that we were discussing. So just a little bit in terms of dengue cases and the predictive ability of the model. Little black line there represents what was actually observed, and the little purple dash line actually represents what would have been predicted, because we would have used past data to generate the model, but of course we test and look back to see what the correlations were. And you can clearly see that there's a pretty good correlation just visually between what was observed as well as what was predicted. Okay, so this is another way of representing the information. But what we can clearly see is that if we look at these maps here and the dengue incidence rate on the left-hand side, and we look at, say, the standardized precipitation index, which is sort of a drought index that our meteorologists use, as well as the El Niño index on the far right-hand side there, you'll see that there seems to be, even visually, a good correlation there between the incidence rate, the precipitation index, as well as the El Niño index. So where the things get a little more intensely colored, there's a good correlation there with the number of cases of dengue that we actually see. So this is another heat map, and it represents the ability of the model to actually predict the outbreak. So just in terms of an interpretation of it, of course, the more intense the color, that's where we expect to see the outbreaks actually occurring. And little x is, in fact, where an outbreak would have taken place. So the model that was developed, and I think this is one for actually Barbados, we can clearly see that, say, between 2004 and 2006, nothing significant was going on. Nothing was really predicted. And because there's an absence of X's, of course, there were no outbreaks. So this model worked really, really well for Barbados. But in 2015, 2016, things started to go a little bit off. And when we were considering, okay, what could have been the reason why there was a little disparity there, we realized that towards the end of 2016, that's when the Zika epidemic really took off in the Caribbean. So there's a possibility that in terms of the health data that was being recorded, the emphasis may have been a little bit more on Zika than dengue. So the dengue data was a little skewed at the time. But otherwise, based on the past years, it actually did work pretty well. So what is the real intent and purpose behind generating these different models? As I said, what we'd really like to do is to aim for predictive forecasts such that, let's say, given a 3 months, we know that based on certain weather conditions that are expected in the upcoming months, and combining that with our past information, climate and health information, we hope to be able to give the ministries of health at least a 3-month warning as to the potential for a dengue outbreak. So with that in mind, and we know that an incident is actually going to take place, the health authorities can put in place the necessary prevention and control measures well in advance to, one, mitigate or decrease the scale of the outbreak, or perhaps even preventing the outbreak from actually occurring. Now, I do have to say that we actually did pilot this model for one of our countries during the Cricket World Cup season that was held last year. And we were actually able to accurately predict a model, and the ministry did, in fact, take those necessary measures. And well, the good news is we did not actually hear of the outbreak. So it means that the prediction effect, as well as the measures taken, really did work. So in terms of using these early warning systems, but operationalizing them so that they have a real-time effect, there are some questions that we actually need to consider in order to sustain these activities. So, for example, if you're looking to implement these systems, how will your stakeholders actually maintain the involvement in the process? So between our climate and our Met folks, how will they continue to engage and in what capacity? Who's going to be in charge of maintaining and funding these systems in the long terms? What are the specific outputs that are needed by the health sector to actually inform their public health decisions? Who's actually going to monitor and evaluate the systems to ensure that they're functioning as they should, they're giving the appropriate information, and they're having an eventual impact? And lastly, what is the return on this investment? Because I have to say that the work, that's being done, a lot of money goes into it. So what's going to be the return, and how is it actually going to be communicated to the public? Right. So in terms of the current work that we've been doing for the last few years or so, we've been doing some pilots with 3 Caribbean countries over the last 2 to 3 years. We have developed the models for all the 3 countries. We've conducted training within each of them. And right now we are in the operationalization phase. So we're looking at where we're actually going to host these models. We're considering a regional server where everyone has secure access to their individual data. We're looking at trying to build systems such that there is less demand on the individual and manual data entry. So we're trying to automate the push and pull processes for that. And also, of course, in terms of sustainability, to sort of well define the roles that both the Ministry of Health and the Met Services will play. Right? So it's really good work, but as I said, it does cost quite a bit. So our previous work was funded by the EU Climate Project, the EU CARIFORUM project, and we do have some additional funding under the Pandemic Fund grant to expand the work. And we're hoping to not just only concentrate on dengue in the future, but also other diseases, and in conjunction working with CIMH, also make the transition to some of the chronic diseases. So perhaps maybe looking at some Saharan dust modeling, looking at heat-related illnesses, as mentioned previously. Okay. One of the things that I would like the folks here today to note is that each model is actually specific to each country. Yes, we may start off with something generic, but when working with the country and seeing what's at play, there are small and individual tweaks that we have to do to refine it and ensure that it's the best fit. Yeah, so one size does not necessarily fit all. We need to adapt as we encounter the specific conditions for each country. Right. So some of the key takeaways in order to co-design, formulate, and implement early warning systems, for example, for dengue, very strong partnerships have to be developed between our public health stakeholders, our climate and health researchers, data managers, etc. In designing these models, we really do need long-term historical data sets. When we originally started the process, we thought that perhaps it would be 10 years of data, both on the health side or on the Met side, might have been sufficient, but we realized we really needed to delve deeper. So 20 and 30 years gave our models better performance. Yeah, and eventually, once we're actually implementing these different models, we need to have a real-time data streaming process in place to ensure that routine prediction and the capacity to respond to these outputs from the models, they're actually being acted upon. Okay, so with that, I'm just going to say thank you, and I'll defer back to Danielle.
Thank you so much, Dr. Boodram. Truly exciting, and just to learn the process and everything it takes to develop these very important early warning systems. So thank you so much. Encouraging you all to please put your questions in the Q&A. And so next, we will transition to Dahlia Plunkett. So Ms. Plunkett is an environmental health specialist in surveillance in the Ministry of Health and Wellness in Jamaica, with the responsibility of managing surveillance data for specific diseases and health events. Ms. Plunkett holds a Bachelor of Technology degree in Agricultural Production and Food Systems Management. She also holds a Master of Public Health degree from the University of the West Indies, Mona. Ms. Plunkett is a One Health leader, trained under the One Health, One Caribbean, One Love Project, One Health Leadership Series. She is the initiator of the One Health Lecture Series, which was a platform to sensitize and advocate for One Health as an important approach to address local and global health issues. Thank you so much for being here, Ms. Plunkett, and I will hand it over to you.
Thank you to Saria. Let me share. Just confirm that you're seeing my slide.
Yes, we see it perfectly. Thank you.
Thank you so much. And thank you to all the panelists, which have made it really easier for me. You have really set a foundation for my presentation. Thank you to the organizers for allowing me this opportunity to share today. And of course, welcome to all the participants. So today, my topic really is examination of data availability and access for surveillance systems in climate and health. And I'll be speaking in relation to the Jamaican context. So bear that in mind. And so some important components of effective data gathering and data sharing for climate action in health. I'll be looking at three main areas: understanding climate-related health risk, building climate-resilient health systems, and just focus on a couple of items under that. And number three, opportunities for climate and climate-sensitive data. So for climate change, we have recognized that it does pose several significant health risks, and just to name a few: vector-borne diseases, heat-related illnesses, respiratory, cardiovascular diseases, waterborne diseases, foodborne illnesses, mental health impacts, and extreme weather events. And some of these were mentioned prior. And because of these risks, it really ensured or really put forward the point that there is a need for building climate resilient health systems. And as such, we're able to mitigate and adapt better. And also it allows for us to recognize the health impacts of climate change more readily as we go forward. And an underline or the key component of that is data availability and data access going forward. Now, in terms of building climate resilient health systems, I want to first just look at a couple of guidance documents or operational frameworks that are available, starting with the World Health Organization, looking at their 10 building blocks for building climate resilient health systems. We won't be looking at all 10 today, but those that really speak specifically to data gathering and data sharing. And I have 5 here, including health workforce, water, sanitation, and hygiene, sustainable energy services. But I want to emphasize leadership and governance, integrated risk monitoring, and early warning. And for leadership and governance, what is important about this is that it emphasizes the need for integration of climate resilience into our health policies and our planning, and allow for us to use our data to inform decision making, which is extremely important. Integrated risk monitoring and early warning, of course, emphasizes the need for data collection, the analysis, and the dissemination of that data. And this can be done in several ways. It can be in a totally integrated manner or just collaborative. There is a little difference between the two. but it allows for us to recognize the importance for climate-related health risk and their outcomes, and also for the monitoring and evaluation of our interventions and our systems that we have in place, our data systems and data processes. In our context, or in the context of Jamaica, I want to emphasize here that we do have a climate change policy framework in place, which is good. It does speak to the fact that, we have begun some work in that area, and there are some initiatives that have come out of that. What I have here is just a few, but it speaks to the Improving Climate Data and Information Management Project and the Pilot Program for Climate Resilience. The Jamaica Health Sector Plan also is an important aspect, which comes under our Vision 2030 plan, of course. This has several strategies, but National Strategy 1 and 2 also speaks to data availability and access. And Strategy 1 speaks to safeguarding access to equitable, comprehensive, and quality health care. Under this particular strategy, the emphasis is on robust health information systems. We were able to monitor and respond effectively to health threats. Emphasis is also on the timely and accurate data, which is important because, the accuracy at the beginning is important. If it's not accurate, then we will be producing information that will not really direct us or guide us along the best approaches or response as it relates to our health threats. Specifically, as it relates to the strategy number 2, which is strengthening leadership and governance for universal health coverage, this specifically speaks to the integration of climate resilience and health data into our policies and planning. Of course, this is a process, but we have begun that process, which is important. It allows for the response for our health systems to be responsive and adaptive. And specifically, as it relates to our health sector plan on climate change, responding to public health challenges relating to climate change, there are several initiatives that have begun, including our vulnerability and adaptation exercises in terms of developing climate smart policies and implementing heat health warning systems. Of course, these require collaboration from different stakeholders as it relates to data and data sharing. Now, a key component of this strategy is the strengthening of our surveillance system, disease surveillance system, and that's where I want to spend a little bit of time to talk to us about today. So we all hope and we all strive for a robust surveillance system. But, in the context of climate change and climate data, for most surveillance systems, when they were being established, years or decades ago, climate was not at the forefront at that particular time. And so some of those systems would not have considered climate data. But most countries, I believe, including us, would have some form of surveillance system in place. And so what is needed at this time might be just for modification to different aspects, and that would require some assessment of what we have. Of course, there are some foundational pillars as it relates to our surveillance systems, which includes the timeliness of our data, the sensitivity of our system, specificity, the representativeness. It has to be flexible, acceptable, and there must be some ethical considerations, and we'll speak on that a little bit more. Specifically to our data, the collection of our data is important in any surveillance system. And there are some key aspects that must be considered. We must know the type of data that we want to collect. The case definition, for even climate data, if we speak about heat strokes or heat stress, just some examples here, those kind of definitions are important so that we're able to collect and be able to not miss the information that we need to have. Of course, the frequency of that data collection. How often do we intend to collect our data, this particular data? And of course, there must be a structure in place for that. In our sense, we have, for example, our health centers, our hospitals, and these are routinely, these facilities routinely submit data on a weekly basis, for example. And so there has to be a structure in place if we really want to be able to capture the data. So we must know what we want to collect, and we must have a system in place to be able to collect that data. The idea of data integration is very important because even as we speak about the climate data on a whole and climate and health data, these come from different entities in most instances. Some may come from, say, for example, our surveillance unit, Ministry of Health, but there are other data like climate data that may come from the Met offices or Met services. And then there's the environmental health data. So there are different data that may be coming from different areas. And so there has to be a way to integrate that data. It might be, for example, a central place, but, for many persons, that's a far or a long process, but there has to be some way to allow for that integration so that we're able to look at the data in a much broader sense. And of course, managing that data, doing our validations, ensuring that what we are collecting is what we really need to collect, and being able to analyze that data and interpret it. One of the things I like to say is converting our data into useful information, because, it's not just submitting raw data, but it should be useful. And there are many persons or entities and agencies and ministries that would rely on our data, ranging from policymakers to our public. And so it must be converted into a useful manner. Data governance, which is also significant, especially as it relates to data sharing, ensuring that there are standards and protocols in place to be able to allow for the easy sharing of data to those who will need it. So some key considerations and challenges in data gathering and data sharing, and I just have some list here, just listed them here, and I will just go through that listing quickly. So our data source, where we get our data from, is important. Our data volume, sometimes we collect a whole lot of data, but we have not clearly defined what we want. So we have a lot of data, but not necessarily always useful. The quality of our data, ensuring that there is some level of confidentiality, because in many instances we collect data that is confidential. It has personal or identifying information, and so we therefore have to be sensitive about that. Compliance to data regulations, if they are there in our context, we do have a Data Protection Act, and we must abide by that. Cyber threats, for example, if you're using a digitized or fully digitized or partial or electronic system, that is important. There are also some other challenges as it relates, especially in relation to data sharing, tedious processes, and this is something we hear a lot, siloed approaches, and so there is not that willingness to share the data when it is being requested. There's also the lack of clarity, because sometimes persons or agencies are not clear on what they require. And that's very important, because if you are not clear about that, then you won't necessarily get what you need. And the awareness, what I've also found is that many of our agencies or ministries or departments do have various platforms for sharing data. What is lacking is that the awareness is not there. Persons do not know where or how to access that data. And so, just to kind of give some examples, you might find it on websites, reports, reviews, publications, research papers, for example. But in the event that it cannot be found there for most places or agencies or ministries, there would be some kind of protocol or, for requesting that data. It may be formal or it may be informal, but being aware of what that is allows at least, to have some form of ease as it relates to accessing that data. It's important in terms of assessing these that we recognize that our data is about telling a story about the who, the where, what, the how, people, time, place. That's very important. And so as it relates to climate and health or climate related health conditions, it's important that we are capturing data that is able to tell the story as to what is really happening as it relates to climate and health overall. So some opportunities for climate and climate sensitive data, just to name a few. Integrated surveillance systems, there's opportunity for more of that. And we saw some of our earlier presenters who, spoke on some of the activities that have been occurring where this particular opportunity is actually being capitalized on. So in terms of strengthening our early warning systems and an area of, in terms of improving that integration between our epidemiological data, entomological data, climate data, or in other words, our dengue data versus our Aedes data versus precipitation or temperature or drought data. Together, that is able to give us a much, bigger picture. And as was said to earlier as well in a previous presentation, being able to predict, the possibility of an epidemic, even months before. Also, intersectoral collaboration, strengthening the partnerships, because there are already partnerships that exist. It's about strengthening that partnership and building those relationships so that the processes for accessing data can be, much easier, for want of a better word. Capacity building as well, training and sensitization, public education. One of the building blocks that was alluded to earlier in the presentation was that one of the building blocks was the workforce. And so it's important that the workforce is trained in terms of data collection, data management, all the processes along our surveillance system, a surveillance system that is not just in the context of health, not just about the diseases themselves, but also about those climate sensitive aspects as well. And so in summary, I think I'm on time. In summary, we spoke about the climate-related risks that are there that warrants or allows us to recognize the need for building climate-resilient health systems. And in building those systems, there are policies in place or there are frameworks in place that can help to guide, that process as it relates to the collection of data and specifically climate-related health data, and allows for that data to be readily available and accessible. And of course, also in terms of our surveillance systems, there's always room for modification as the risk increase, and as these risks are assessed, then of course you're able to look at the system and to modify accordingly so that you're able to capture the data that is required, and you're able to integrate where necessary with other stakeholders, with data from other stakeholders. And so this ensures a robust surveillance system that is climate sensitive, that has or emphasizes the pillars of surveillance, of a surveillance system, and also emphasizes the components of a data gathering or data and data sharing system. Also, we spoke on the challenges, some challenges that we may experience in data gathering or data sharing, and we also spoke on some opportunities for climate and climate sensitive data. And so I'm happy to answer any questions specific to any of these at the end. These are my references. And I thank you so much. I hand over back to our host, Saria.
Thank you so much, Ms. Plunkett, for an excellent presentation and an overview of the importance of surveillance data, but also the challenges in sharing the data around surveillance. So thank you so much. And we now have ample time for Q&A. And so we'll invite all of our panelists to the screen. And what we'll do is really kind of go through some of these question and answers, questions that the audience has posted. And I'm going to start with a question that merges what I'm seeing really across all 4 presentations. And that is the question of how do we make sure that all of the information and the sources that you have discussed today are actually reaching the practitioners? And how do we assess the actual impact of those data sources on what the practitioners are able to do? And so if it's Dr. Henry talking about the heat index and utilization of the heat index, as well as other data sources that she referred to, whether it was Dr. Mahon and the bulletin and the important information from the bulletin, the early warning system models from Dr. Boodram, or the surveillance data from Dr. Plunkett. How are we making sure that those data are getting to the health professionals so that they can use them in their day-to-day? And so I'll open that up. That is a question to all of you as we think about really the practicality of making sure this data is utilized.
So can I start, because I think I have a question to the question. So my question is, how could we as practitioners help in the surveillance system? Because we need real-time data. That is important. And we need health climate data. So I am thankful, great presentations, all the predictions, the bulletins. But how do we know when we have a dengue epidemic on? Because it's good to predict, but the problem with climate is that the climate is changing. So we knew there was a wet season and a dry season. Now it's more rain in the wet season. There's more rain in the dry season than in the wet season. And then we would have like 4 periods of rainfall in any one day in the dry season. So this is our dilemma. How do we know there's dengue? Because on the chat, somebody says, oh, are you seeing dengue? And then somebody say, yes, I saw 4 cases yesterday. And then somebody say, really? Yes, I saw so many cases. And then that is how we know there's a dengue outbreak. Okay, and so we know, so we expect, and we do what we need to do. But is that information getting to the people who actually make the difference? And how could we as the practitioners help the situation? And I just want to say, like when we had the Zika epidemic, okay, so it was new and we were given forms to fill out, and we dutifully filled out all these forms, but we realized that too many forms. So help us with the surveillance. I'm asking.
Thank you, Dr. Henry. And as part of that, please address that thing of how do we get this information to the practitioners so that they can utilize it in addition to how they can feed into some of the needs that you have.
Would you like me to answer? Okay, sure, no problem. All right, so two things. I want to speak to the in terms of getting that information out at first. One of the things is, we can't really overemphasize the idea of training and sensitizations. That's very, very important. And that is definitely an ongoing process. That's not like a one-off workshop or a one-off training. You have to be committed to that task. In my presentation, I spoke to, in terms of the data collection, that the case definitions are important. And that is not even, speaking as it relates to just climate data, but even if we're speaking to specific disease conditions, if that is not clear, it could be missed, Right. And so we have to be clear on what we mean by climate-related health risk or climate, illnesses. And there's a definition as it relates to surveillance, because surveillance is meant to pick up, the cases. We don't want to miss them. So those definitions have to be clear, but that definitely will come with more sensitization specific, to the surveillance aspect of climate related illnesses or conditions. That's one. And two, I hope I'm not forgetting what next. Yes, you had asked could you repeat that question? I missed the second question.
Yeah, and I think in terms of getting the data to the practitioners, and you mentioned the training
Right.
is one way to do both that and have them do the data collection and help you out as well. So I think it answers
Absolutely.
both questions. And if I can add to that, there was also a question specifically to you around the data sources that you mentioned, and to what degree is that publicly available and how can people access it?
Right. All right, so for data sources, we do have a system that we rely on depending on the surveillance type, whether it's syndromes or it's a disease condition, depending on the class. So there is a data collection process for that in terms of how persons would notify. But of course, there are other ways to get to your data, even as someone mentioned it earlier too, in terms of the media. That's one approach. In terms of community persons, I think Dr. Henry mentioned it earlier in terms of persons just saying, this is what is happening, this is what I'm seeing. So we look at all the possible channels, where information can come from, though we have a set and structured system. Yes, I'm remembering the question now, as it relates to that integration of our data. You mentioned how we would know when there's an outbreak or dengue outbreak, how we're able to predict that. Of course, it is a process, and we have gone through quite a number of outbreaks, which we have learned from and have improved our systems, based on that. And so we have developed our thresholds, and we have in line and understanding the season, because dengue has been seasonal, but as you rightly say, it is changing in terms of the seasons. And so we recognize the need for more collaboration as it relates to those other units, especially within and outside of our ministries that have those data, for us to create those means to collaborate and to share the data. So far, it has been working for us. Yeah. Thank you.
Thank you, Dr. Plunkett. And then if I can maybe direct the question to Dr. Mahon, also, thinking about the bulletin and really trying to see, is the bulletin reaching your intended audience? Is there a way that you have been evaluating that and trying to think about the impact that it's having? Has there been research done in that realm to understand the impact?
Thank you for the question, Saria. I think it's a great one. I want to preface my answer by saying that at the Caribbean RCC, we have, as I showed through my presentation, invested in a model where we do operationally co-design, co-develop, co-deliver, and co-author, that Caribbean Health Climatic Bulletin, because we recognize that we are not the health experts, and we needed to partner with experts at CARPHA and PAHO who understand the communities that they work in actively, and who understand the language, your needs, so that we could, together make a product that will speak to you, connect to your decision-making context, and in that way impact your decisions. And by partnering with CARPHA and PAHO, we also, I think, were able to leverage the extensive networks that both of these organizations have in the Caribbean health community, where the work of PAHO and CARPHA are recognized and impact health practitioners, hundreds of health practitioners. So, I think we've really tried to set up this co-production model in a way to make impact. I did also show in my presentation the most recent research that we did was in fact in late 2022. And from those many focus group discussions that we had with health practitioners as well as med service professionals across the region, actually, we brought those two communities together in those sessions in 2022. It was actually a time when we were trying to elevate and upgrade the Caribbean Health Climatic Bulletin. And we did the background research to do that in the most effective way. And, you know, as the slide showed, we did get some positive feedback from those sessions. I did go into, you know, some of the specific feedback we received. I will say, though, that evaluation of the impact that the Caribbean HCB is having is not operational. It is ad hoc. It is, for the social scientists in the room, cross-sectional. And so not longitudinal currently, because of course we're so busy doing other stuff like actually producing, co-authoring the bulletin, that sometimes, you know, you don't get the bandwidth, or you don't have the bandwidth to do, you know, these longitudinal studies on impact. So that study is dated 2022, and through the arrangement, the co-working arrangement that we have with CARPHA and PAHO, the very successful operational implementation of the Caribbean HCB, I will say all partners have always come to the table every quarter since May 2017, and we have never failed to deliver on any issue of the Caribbean HCB. And it is our hope that it is making impact, and has been really increasing health resilience in the 7+ years that we've been doing this work. So thank you for the opportunity to share.
Well, thank you, Dr. Mahon. And maybe if I'll direct the question to Dr. Boodram, similarly for the early warning systems and these amazing models that you've created that are at that country level, you know, how is that information of the models getting to the health professionals, to Dr. Henry's point, you know, with an upcoming dengue or predicting these dengue outbreaks? But also, to what degree are the countries that you're working with talking to each other and sharing the data between each other so that they can learn from their responses and their utilization of the data from the models you're creating?
Okay, so thanks, Saria. So in terms of reaching our target audience, well, of course, the two partners at the table are the health and the climate service representatives. And my answer is not very much different from what Dahlia and Roché have indicated. It's really a strong partnership between these two sectors that have led to the development and rollout of these models. But how we actually, because right now we are in the initial stages of operationalization, how we actually envisage the process occurring is that we work with the med folks, we work with the health folks, and then through them, they disseminate the information to their, let's say if we're looking at the health practitioners on the ground. So if the system suggests that there is a dengue outbreak going to take place, they swing into action. They enlist, the environmental health officers on the ground. They enlist their sentinel physicians on the ground to be on the lookout, just basically uptick the surveillance. But additionally, it's really not just the health practitioners that we are focusing on in terms of being the target audience. What we also envisage coming out of this process and in terms of the setup is that there are going to be health promotion messages actually going out to the general public as well, right? So it's a twofold or two-pronged approach in terms of our target audience. I did just want to very quickly speak to the changing climate on these predictive models. So yes, it's all very, very important to constantly get updated data to feed into these models. But we also recognize that because of the changing climate, the model can never be static. It always has to be constantly tweaked in accordance with what we're seeing in the current environment. So whether a human sits down and uses software and tweak it, or whether more recently AI does that for us, it will happen. In terms of sharing the data between countries and lessons learned, I have to say it's an ongoing process and it's still in the initial stages. Countries are a little protective of their data. So while they do recount experiences and best practices, sharing data across countries is something that we haven't quite worked out as yet. But I have to say that there's a good effort, there's a good community of practice, and it's something that we can work on in the future.
Wonderful. Thank you so much. And thanks to all of you. I know we are a little past time. There were a couple more questions that we did not get to, but on behalf of really everyone who was participating today, this was phenomenal. Absolutely excellent presentations all around and a lot of learning for all of us with some key messages as well. So thank you so much to the presenters. With that, I want to first point your attention to the chat where there is a very important link. If you are looking to get CME credit, please click on that link and complete the survey within 24 hours. I'll also use this opportunity to announce the upcoming session, which will be on March 12th, how to build alliances between health professionals and people of faith for a better climate. And so with that, I will thank you all and we will close the session. Thank you so much.
Thank you, everyone. See you next month.
Okay, thank you. Goodbye.
Thank you for the opportunity to be here. Thanks, guys.
Thank you, everyone. Have a good evening.